Just a minute. We'll be discussing about the vitamins. We discussed about vitamin D last time, and we will discuss about the rest of the vitamins today. Yeah, so we'll discuss about the classification and the fats, the two types, the water soluble and fat soluble vitamins, and their function, the source, and the deficiency, and what has caused the deficiency. And so these are a group of organic compounds that are essential for normal growth and nutrition, required in small quantities in diet, as they cannot be synthesized by the body. So this is important. They are not being synthesized by the body, so they are given in the nutrition, and it's essential for the normal growth. And the term vitamin is derived from the words vital and amine, because vitamins are required for life and were originally thought to be amines. So okay, the classification have traditionally been grouped in their solubility in water or fat. So what are those? They are water soluble vitamins and the fat soluble vitamins. And as you know, the fat soluble vitamins, four fat soluble vitamins, the A, D, E, and K. And the water soluble vitamins, they are B1, B2, B3, biotin, pantothenic acid, B6, folate, B12, and vitamin C. Sorry for the interruption. Continue now. So the vitamins are found in almost everything we eat, and the processing affect vitamin content, and the dietary supplements can boost vitamin intake, and not all of what we can get used by the body. So what are the water soluble vitamins? They are vitamin B complex group, and the first one is B1, thiamine. It's very important to prevent beriberi, and so what is the importance? Thiamine helps the body to convert the food into energy. And it aids in the function of heart, in the cardiovascular system, and the brain and nervous system. And what is the recommended dietary allowance? It is 1.5 mg. So what happens if vitamin B1 deficiency is seen? So you will be seeing beriberi, and the early symptoms there will be both wet beriberi and dry beriberi. And the early symptoms are loss of appetite, tingling hands and legs, numbness, and weakness and wasting of the legs and muscles, and the difficulty in walking. And whereas the infantile beriberi is seen when the mother is breastfeeding the baby with the deficiency of vitamin B1, and the symptoms are vomiting, weight loss, swelling, and convulsions. So we'll be seeing beriberi in the deficiency of B1, and symptoms are early, and there is infantile beriberi. So what are the sources of thiamine? The thiamine can be found in fortified breads, cereals, fish, lean meats, and milk. So it is widely distributed in the food. Yeast and liver are the most highly concentrated sources. However, cereal grains are the most important dietary source of thiamine, as these foods are consumed readily in most diets. So though it's present in yeast and liver, the cereal grains are most important because it's mostly taken in the most meals. So what happens? The chief function, the deficiency symptoms and toxic symptoms we'll see here. The chief function in the body is it's a part of coenzyme needed in energy metabolism, supports normal appetite and nervous system function. And the deficiency you will be seeing beriberi, that is wet and dry beriberi, and it is found in pork, ham, bacon, liver, and whole grain. And what happens to the circulatory system when there is a deficiency? There will be edema, enlarged heart, abnormal heart arrhythmias, and heart failure. And what happens on the nervous system or muscular system? There will be degeneration, wasting, weakness, pain, irritability, mental confusion, and paralysis. And the other are anorexia and weight loss. And there are no toxic symptoms seen. That is when there is more required dose of thiamine is taken, there you will be seeing the toxic symptoms which are not seen in with the thiamine. So these are the main we will be seeing beriberi, and it's very important in the function of nervous system and normal appetite. Next we'll move on to riboflavin or vitamin B2. It is very important because it's a part of two coenzymes, FMN and FAD, which are oxidizing agents. So it works with other vitamins to promote healthy growth and tissue repair and helps to release energy from the carbohydrates. It helps in maintaining healthy skin and healthy red blood cell production. And the recommended dietary allowance is 1.7 mg. The symptoms of riboflavin deficiency are stomatitis, anemia, swollen and dark tongue, and angular chelosis, that is cracks in the corners of mouth and lips. So the symptoms of riboflavin deficiency are stomatitis, anemia, swollen and dark tongue, and there is cracks in the corners of mouth and lips. So here you can see tongue being dark here. And where are the sources that you will be seeing vitamin B2 that you can be taken is cereals, nuts, milk, eggs, green leafy vegetables, and lean meat. So these are the food sources where vitamin B2 is available. And the recommended dietary allowance is 1.7 milligram per day. So here you can see again, the chief function is it's a part of coenzyme needed in the energy metabolism, supports normal vision and skin health. And deficiency is called arabidoplavinosis. And the significant source, as we discussed, are milk, cheese, leafy green vegetables, and meat. And what happens in the deficiency symptoms? There will be cracks at the corners of mouth, and there will be tongue being enlarged, and there will be sore throat. And the hypersensitivity to light is seen, and the nervous system and eyes are involved. There will be reddening of cornea and the hypersensitivity to light. And the skin rash, as we discussed, it helps in maintaining healthy skin. So the deficiency leads to skin rashes and the hypersensitivity to light. And there will be reddening of cornea. And most importantly, you'll be seeing cracks at the corners of mouth and the tongue being enlarged. And there will be sore throat. So these are seen in deficiency of vitamin B2, that is riboflavin. And the anemia, you can be seeing microcytic anemia will be seen. And the smoothness of tongue is caused by loss of its surface structures and is termed as glossitis. So glossitis, that is the smoothness of the tongue is lost because of its surface. And we can see here, this is how it will be seeing the tongue when there is a riboflavin deficiency. This is how the tongue will be. And there will be cracks here. You can see here the crack at the corner of the mouth. Next, we'll move on to niacin or vitamin B3. Niacin is it prevents in the development of pellagra, and it is isolated from nicotinic acid, and it plays important role in the coenzyme NAD, which is very important for metabolism. So it works with other vitamins to help the release energy from carbohydrates, and it helps in the maintaining of healthy nerves, healthy skin, and healthy digestive system. And the adult recommended dietary allowance is around 15 to 19 mg, and we can take as 19 mg as the recommended dietary allowance. So where you can be seeing this source of niacin is, it includes dairy, poultry, fish, lean meat, nut, and eggs. So it can be seen in the dairy products and the poultry and the fish and lean meat and nuts and eggs. So what does the deficiency of niacin leads to? And we see as 4 Ds, that is dermatitis, dementia, diarrhea, and death. The 4 Ds of niacin. And pellagra, you will be seeing dermatitis, and there will be diarrhea, dementia, and death. And other than that, we will be seeing muscular weakness, anorexia, indigestion, and skin eruptions. So the 4 Ds of niacin deficiency are dermatitis, diarrhea, dementia, and ultimately leading to death. So you can see due to deficiency, the inability to absorb niacin or the amino acid tryptophan may cause pellagra, a disease that is characterized by scaly sores, mucosal changes, and mental symptoms. So due to the deficiency, you will be seeing or the amino acid tryptophan absorbability, inability to absorb, then you can be seeing cause pellagra. And how they present as? They present as scaly sores, mucosal changes, and mental symptoms. You can see the skin changes in the dermatitis changes in the pellagra. Here you can see in the both hands, their bilateral symmetrical involvement is seen. Whenever the limbs are involved, or you will be seeing the dermatitis involvement of skin in the pellagra, it is mostly bilateral and symmetrical involvement. So the other names are, you can call it as nicotinic acid, nicotinamide, or precursor in dietary tryptophan. The chief function is it's a part of coenzyme needed in the energy metabolism, and the deficiency leads to pellagra. So on the digestive system, when there is a deficiency of niacin, it leads to diarrhea, vomiting, and abdominal pain. On the mouth, gums, and tongue, it leads to black or bright red swollen smooth tongue. On the nervous system, it leads to irritability, loss of appetite, weakness, headache, dizziness, mental confusion, and which progresses to psychosis or delirium, and ultimately may lead to death. And the skin, you will be seeing flaky skin rashes on areas exposed to sun, such as hands and the feet and toes. And the other one is the toxic symptoms. So whenever there is excessive niacin being taken in, then you will be seeing nausea and vomiting, or painful flush and rash and sweating on the skin. And then there will be liver damage or impaired glucose tolerance. So the toxic symptoms which are not seen in B1 and B2 when they are taken at excessive amounts, but they are seen in niacin, and they lead to liver damage and impaired glucose tolerance. And the points that to be remembered is 4Ds, that is diarrhea, dermatitis, dementia, and death. So that is pellagra is the disease that you will be seeing with a deficiency of the niacin. Next is vitamin B5 or pantothenic acid. It's a part of coenzyme A, which plays an important role in the energy metabolism, and it is essential for the formation of ATP from the breakdown of carbohydrates, protein, fat, and alcohol. So it's being a part of coenzyme A, and it's essential in the formation of ATP. And the sources of pantothenic acid or the B5 is meat, milk, mushroom, liver, peanuts, eggs, and yeast. So if you can see, the most of the vitamins are present in meat and milk and the eggs. So what happens when there's a deficiency of B5? So it leads to headache, fatigue, impaired muscle coordination, and GI tract disorders. The recommended daily allowance is 5 milligrams per day. Next is vitamin B6 or pyridoxine. It's a very important vitamin since it plays a coenzyme role in more than 100 enzymatic reactions. So it's B6 or pyridoxine. So it's important in maintaining healthy brain function, the formation of red blood cells, the breakdown of protein, and synthesis of antibodies in support to the immune system. It's a very important one, B6, because it helps in the immune system in production of antibodies. And the recommended daily allowance is dietary allowance is 2 mg. So where do you see the vitamin B6? In the animal tissues, the fish, the poultry, the whole grains, and some fruits and vegetables, mainly bananas, carrots, potatoes, and avocado. So what happens when this deficiency of vitamin B6? There will be weakness, sleeplessness, peripheral neuropathy, personality changes, dermatitis, and glossitis. So we'll move on to this. The B6, the other names pyridoxine, pyridoxal, or pyridoxamine. It's a part of coenzyme needed in amino acid and fatty acid metabolism and helps in conversion of tryptophan to niacin and to serotonin and helps in making of red blood cells. So it helps in conversion of tryptophan to niacin and to serotonin and helps in the formation of red blood cells. So what happens when there is a deficiency? So on the blood and circulatory system, you will be seeing anemia, the small cell type. On the nervous system or muscular system, you will be seeing depression, confusion, abnormal brain wave pattern and convulsions, and there will be peripheral neuropathy also. And on skin, you will be seeing rashes, and scaly dermatitis. So what happens when there is an excessive of vitamin B6 being taken in? There will be depression, fatigue, or headache, and a numbness, or there will be difficulty in walking. In skin, there will be leading to skin lesions. So the most important one is you should remember is peripheral neuropathy and personality changes, and dermatitis and glossitis will be seen, and there will be anemia also present. Biotin or vitamin B7. It participates in the reactions in which carbon dioxide is added to as a compound. So the functions are, it's an essential cofactor for 5-carboxylase enzyme that adds to CO2 to various compounds. Where the sources of biotin are whole grains, eggs, nuts, and the legumes. In the deficiency of biotin, leads to skin rashes, neurological disorders, and impaired growth. And the recommended daily dietary allowance is 30 mg per day for the adults. So you can see now we'll discuss about pantothenic acid and the biotin. The pantothenic acid deficiency leads to vomiting, intestinal distress, insomnia, fatigue, hypoglycemia, and increased sensitivity to insulin. And also there will be burning sensation in the feet. So that is the most common symptom that patients will be complaining of. Burning sensation in the feet is most commonly seen in the pantothenic acid deficiency. And the other things are vomiting, intestinal distress, insomnia, fatigue, hypoglycemia, and increased sensitivity to insulin. Whereas biotin, which is a cofactor in energy metabolism, mostly carbon dioxide involved. So there, this deficiency leads to abnormal heart action, loss of appetite, nausea, depression, muscle pain, weakness, and numbness of extremities. And the other skin manifestations are there is a dryness around eye, nose, and mouth. So this is normally you will be seeing. Biotin deficiency will be seeing dryness around the eyes, nose, and the mouth. And there will be depression, muscle pain, and weakness, fatigue, and numbness of the extremities. Folate or vitamin B9. So the folate is derived from Latin word means leaf because it's found in dark leafy vegetables. So the sources include dark leafy vegetables, beans, legumes, fruit juices, shellfish, and liver. So dark leafy vegetables are the most important source of the folate. So what are the functions of the folic acid? So it aids in the production of red blood cells. It helps in the synthesis of DNA, and it works with B12 and vitamin C to digest and utilize the proteins. So the three main functions are it helps in the production of red blood cells, in the synthesis of DNA, and it also helps in the works in the vitamin B12 and vitamin C to help the body digest and utilize the proteins. What does a deficiency of folate lead to? So it leads to the reduced ability to synthesize DNA, and it leads to anemia. So it is also important in the formation of neural tube formation. So deficiency of folic acid in the mother leads to neural tube defects in the child. The recommended allowance is 400 mg per day. So we'll discuss it again here. The other names are folic acid, folacin, and the chief function is coenzyme needed for new cell synthesis. So on the circulatory system, as we were discussing, it helps in the production of cells, red blood cells, and leads to anemia. The large cell is macrocytic type of anemia and with elevated homocysteine level. And the digestive system, it leads to diarrhea, constipation, and heartburn. And it helps in the production of DNA. And on the immune system, it leads to suppression of the immune system and frequent infections. And on the mouth, gums, and tongue, it leads to smooth red tongue, increased risk of neural tube birth defects. When the mother is having deficiency of folic acid, then you will be seeing increased risk of neural tube birth defects. And on the nervous system, it leads to depression, mental confusion, fatigue, irritability, and headache. So this is the deficiency symptoms. And the important one that you should be remembering is the increased neural tube defects in the newly born child. And next we'll move on to vitamin B12, cobalamin, very important, and it helps in various coenzymes. So where are the sources that we'll be seeing vitamin B12? The vitamin B12 is mostly found in eggs, meat, poultry, shellfish, and milk products. So very important. It's found mostly in milk and milk products and eggs. So it's very important for the, as we were discussing previously also, it is also very important for nervous system and red blood cell production. And the nervous system, it involves both brain and spinal cord. And the recommended daily dietary allowance is 2.4 mg per day. And its deficiency, as we all know, leads to anemia. So what does it happen? The anemia, it's a large cell type anemia. So here I'll show it again. The small cell type anemia is called microcytic anemia, whereas the large cell type anemia is macrocytic or megaloblastic anemia seen in both B9 and B12 deficiency. And the smoothness of the tongue is seen and is caused due to loss of its surface structures termed as glossitis. And there is fatigue, nerve degeneration, and progressing to paralysis. So very important point. Though there is tingling and numbness and other things like anemia and smooth tongue, there will be nerve degeneration which progresses to paralysis, and there is a fatigue seen. The name pernicious anemia refers to vitamin B12 deficiency caused by the lack of intrinsic factor, but not poor caused by the inadequate dietary intake. That is one thing you should remember. Now we'll move on to vitamin C or ascorbic acid. It is involved in many processes, and the important function of the vitamin C is the synthesis of collagen, the principal tissue protein found in tendon and artery. So, vitamin C, it promotes healthy immune system, helps wound healing, maintains connective tissue, and aids in the absorption of iron. And the daily dietary allowance is 60 mg. I'll come again. It helps in the wound healing, maintaining a healthy immune system, maintains connective tissue, and aids in the absorption of iron. And the sources are fruits and vegetables are the major sources of vitamin C, such as citrus fruits, broccoli, and the green pepper. Here you can see a few other. The sweet and white potatoes are also excellent food source of vitamin C, along with these citrus fruits, the broccoli, and there is also seen in strawberries. So the vitamin C deficiency, as we all know, it leads to scurvy, and also there is weakness, fatigue, and this is important, there is inflammation of the gum, and there's impaired wound healing, and it leads to hemorrhages and depression as also seen. And how is the scurvy characterized by? It's by weakness, anemia, bruising, bleeding gums, and loose teeth. So deficiency of vitamin C leads to scurvy, which is characterized by weakness, anemia, bruising, bleeding gums, and loose teeth. So here you can see the bleeding gums, the teeth being loose. So this is how the presence with the scurvy will be presented in the patient. So the chief functions, as we discussed previously, is collagen synthesis. It acts as an antioxidant, and it also helps to restore vitamin E to the active form. It helps in the hormone synthesis and supports immune system and helps in the absorption of iron. So what happens when there is a deficiency? It leads to scurvy. On the immune system, as it helps in the immune system, the deficiency leads to immune suppression and it leads to frequent infections. And on the mouth, gums, and tongue, it leads to bleeding gums and loosened teeth. And on the nervous system, it leads to muscle degeneration and pain, depression, and disorientation. And on the skeletal system, it leads to bone fragility and joint pain. And on the skin, you will be seeing there will be pinpoint hemorrhages and rough skin and blotchy bruises. And the other is the failure of healing of the wounds. So the important one is immune system suppression leading to frequent infections. Wound healing will be delayed, and there will be pinpoint hemorrhages. And as you see in the scurvy, you will be seeing bleeding gums and loosened teeth. So these are the common deficiency symptoms you'll be seeing in vitamin C deficiency. So now we'll move on to fat soluble vitamins. There are four: A, D, E, and K. Vitamin A, it helps in the formation of epithelium, skin, and mucous membrane, and it helps maintenance of healthy eyes, and it assists with bone remodeling. So it helps in eyes, bone remodeling, and also skin and mucous membrane. So what happens when there's a deficiency? There will be dry skin, poor immunity, and slow growth. And on the eyes, it will lead to night blindness and xerophthalmia. So you can see this is how the retinopathy will be seen, and the night blindness in the children in vitamin A deficiency. So it helps in maintenance specialized tissues such as retina, aids in the growth of healthy skin and mucous membranes, and it promotes normal development of teeth, soft and skeletal tissues. And the valence is 1000 μg. So where do you see the vitamin and beta carotene? It comes from animal sources such as eggs, meat, and dairy products. And the beta carotene, a precursor of vitamin A, comes from green leafy vegetables and intensely colored fruits and vegetables. So the chief function is vision, health of the cornea, epithelial cells, mucous membranes, skin and bone and tooth growth, regulation of gene expression, reproduction, and immunity. And this beta carotene, which is a precursor, acts as an antioxidant. And the deficiency is hypovitaminosis A. So what happens on the circulatory system? There will be small cell type, that is microcytic anemia. And on the bones and teeth, because it helps in the formation of bones and teeth, there will be cessation of bone growth, painful joints, impaired enamel formation, cracks in the teeth, and tendency towards tooth decay. And there's a deficiency. On the deficiency on the digestive system, it leads to diarrhea, changes in intestinal and body lines. And on the immune system, it leads to frequent infections as an immune suppression. And on the nervous and muscular systems, the most important one is night blindness, and also it leads to mental depression. And on the skin and the cornea, when the eyes are involved, there will be corneal degeneration leading to blindness and keratinization. And others, there will be kidney stones and impaired growth. So, whenever vitamin A is asked, because the chief functions are vision, health of cornea, epithelial cell formation, mucous membrane, bone formation, and the regulation of gene expression. So whenever and immunity, whenever there is a deficiency, all these systems are involved, leading to cessation of bone growth and leading to painful joints, impaired enamel, cracks in the teeth, and the tendency to tooth decay, along with night blindness and the corneal degeneration also leading to blindness, total blindness, and there will be frequent infections. Next, so vitamin D, as we discussed in the last class, is considered as a hormone that facilitates absorption of calcium and phosphate. It assists with the bone formation by aiding the absorption of calcium. So it promotes the body absorption of calcium, essential for development of healthy bones and teeth. And the sources is milk, meat, and the deficiency of vitamin D or inability to use vitamin D leads to rickets in the children and osteomalacia in the adults. So this is how the patient's children will be presenting with the rickets, and the osteoporosis is also seen. We'll just discuss it fastly. The chief functions is mineralization of the bones, that is raises blood calcium via absorption from digestive tract or withdrawn calcium from bones and stimulating the retention of the calcium in kidneys. And the deficiency leads to rickets and osteomalacia. So there will be abnormal growth, bowing of legs or softened bones or joint pains and malformed teeth. In the nervous system, there will be muscle spasm. Next, we will move to vitamin E. Vitamin E is an antioxidant and it promotes the red blood cell formation. And the deficiency in the vitamin E leads to hemolytic anemia, and the required dose is 15 mg per day. How does it function? The benefits of vitamin E are: it protects cell membrane and tissue from damage by oxidation. aids in the formation of red blood cells and the use of vitamin K, and it promotes the function of healthy circulatory system. And the functions of vitamin E, when the vitamin E, it helps in the slowing the cognitive decline in the Alzheimer's patient. This is the recent studies are helping, and it's helpful in Alzheimer's patient. It helps in the lowering the blood pressure and cholesterol levels, and it protects the tissues from destructive action of oxidants. In the sources, it is seen in corn, nuts, olives, green leafy vegetables, vegetable oils, and wheat germ. But food alone is cannot provide beneficial amount of vitamin E, and the supplements may be helpful. So, the chief function of it is it's an antioxidant, helps in the stabilization of cell membranes, supports immune function, the protection of polyunsaturated fatty acids, and normal nerve development. So, whenever there is an deficiency, it leads to nerve degeneration, weakness, difficulty in walking, and the cramps, and also the red blood cell breakage and anemia. So the last one, the vitamin K, it assists in the synthesis of prothrombin required for blood clotting, and the deficiency leads to prolonged bleeding and increased clotting time. The vitamin K, it includes the mostly found in cabbage, cauliflower, spinach, and other greeny leafy vegetables, as well as cereals. So the vitamin K, the benefits are it helps in the blood clotting, and 70 milligram is the dietary advice to be taken. And when there is deficiency of vitamin K, you'll be seeing hemorrhage, poor poor skeletal mineralization. We'll just go back and just discuss about vitamin A once. It's important. Vitamin A, this assists in the formation of epithelium, skin, and mucous membrane. It's maintain healthy eyes, assists with bone remodeling. So, whenever there is a deficiency of vitamin A, it leads to anemia. There will be cessation of bone growth, painful joints, impaired enamel formation, the cracks in the teeth, and tendency towards tooth decay. And there will be night blindness and mental depression. And the keratinization and corneal degeneration will lead to blindness, permanent blindness, and there will be rashes on the body. And as the immune system is involved, there will be frequent infections. These are the normal, and the toxicity symptoms also important. Whenever there is an increase, there will be red blood cell breakage, cessation of menstruation, and nosebleeds, and there will be growth retardation and increased pressure inside the skull, and there will be blurred vision or muscle weakness or fatigue or irritability or loss of appetite. And on the liver, it will be liver enlargement and liver damage, and there will be birth defects. So these are the toxicity symptoms, and these are deficiencies. And vitamin D, as we all know, it is important in the formation of bones, and the deficiency in children leads to rickets, and in the adults leads to osteomalacia. And vitamin E, it helps in the protecting the cell membranes and tissue from damage by oxidation, aids in the formation of red blood cells and the use of vitamin K, and promotes the healthy circulatory system. And vitamin K, it helps in the the vitamin K, it helps in the synthesis of blood clotting proteins and important in bone mineralization. And the deficiency of vitamin K leads to hemorrhage and poor skeletal mineralization. And the toxicity will lead to interference with anti-clotting medication. It's a toxicity that will be seen when vitamin K is given in the excess. So I think this should be enough. That's the end of the class. And we'll meet in the next class. Thank you.